Jane didn't have sex with her husband for about 10 years. She blamed the menopause and the vaginal dryness. Both started when she had her ovarian removed. She didn't pay any attention to the surgery. After all, it was her fifth one. She had 4 cesarean sections before. What do you say? How will you diagnose a case like that? Now, of course, you don't have enough details. And definitely, we can look at a case like that, at any case, from many points of view. Maybe it's her menopause. Oh, just she doesn't love her husband anymore. Or maybe it is true what some say. There is no sex life after the age of 60. We don't know. But I'm here to talk about trauma. That is me, and that's my mission. That's what I do. And I just realized that I didn't introduce myself at all. So maybe it's a good point to tell you how come I am working so much with trauma. So who am I and where am I coming from? So I'm working in psychiatric institute for young adults in a different degree of addiction. As a result of the drug abuse, they had a psychosis and severe breakdown. I'm using here a lot of words. I'm talking about psychiatric institute, I'm talking about addiction, drugs, psychosis and severe breakdown, and I am not sure that the image that you have in mind when hearing those words is the same thing as in my reality. Let's go one by one. Let's psychiatric institute. What image do you have in mind? How many of you have this image? Actually, the place I'm working in is a bit different. Have a look. It's called Izun Institute. As you can see, it's next to the sea. That's where the patients are living in. It's really just 100 meters from the water. And that's my treatment room, actually. Unfortunately, the patients are not allowed to go to the beach itself. The place has no fences, as you can see, which means that someone can be totally psychotic without any physical fences that hold him there. The place was established almost 20 years ago as a private one, but now it's funded by the government. And it's for young adults in a breakdown. It could be a psychosis, it could be a depression, addiction, or any major breakdown in life. The place was pioneer in the treatment of addiction and mental illnesses. And until recently, it was the only place in Israel where you can be in a psychotic state outside in a hospital and come down slowly from the psychosis. It has a unique program. It's 5 months, 24 hours a day, 7 days a week. Each patient receiving two psychotherapy sessions a week, one family therapy, one holistic therapy is Chinese medicine or shiatsu, and many type of group therapies, group sessions, is a drama, addiction session, group session, dynamic group, art, yoga, many type of movements, and that's a place. Another word that I was using is addiction. When you are hearing the word addiction, how many of you has this image in mind? Actually, we are working with people as me and you. How many of you have friends that they know that is using drug in one level or another. Now, there are many levels for addiction. It's not either you are addict or not. It's not on and off. And there are many levels. And we are working with young, mostly have a job or even a university degree. There are no low socioeconomic. They're pretty average. And mostly they're using marijuana and party drugs. Sometimes coke, but not so much. The level of using coke is, we can't handle a high level of using coke, but I think recently it's increasing, the use of cocaine. We call it normative and functioning drug user. And statistically, here in that room, we have at least 2, 3, 4 people that are falling to that normative and functioning drug user. And I was using the word drug. Now, until recently, the world was on war. Was in a war on drugs for about 40 years. But recently, we see a major shift. Countries are starting to allow it, either for medical reason or recreational reason. And the drugs are being used, drugs, I should say, psychoactive substances are being used for healing, either marijuana for cancer. There is a very big experiment in Israel for using MDMA for the treatment of PTSD, post-traumatic stress disorder. It is an experiment with a cooperation with the FDA, the American FDA, and even before that it has been approved, they are using it, offering it as a practice for healing PTSD. Now, so from one hand, we see the abuse of it, the recreational drugs. We see people that are getting into a psychosis and major breakdown because of using of drugs. And from the other hand, there is a healing processes with the same substances. It is very, very confusing for the users or for the young generation, and we will see it more and more spreading all over with a good side of it and with the side effects of it. And I was using the word psychosis and severe breakdown. It is a huge subject. But the main thing, I think, when working with psychosis, with the extreme of the mental illnesses or mental states, or in our terms, when we're working with a shared disturbance, I think that's a place to learn so much about our spiritual realm and the Shen and our mental. But that is for other seminars and lectures. So that's the place I'm coming from. Now let's go back to Jane. I wasn't totally honest with you. She didn't come to me for the treatment because of her sex life. That was a major issue in the treatment, that's true, but she came in a severe breakdown in life. Jane had totally normal life when coming back from visiting her parents in the US. She was overwhelmed from the thought of their coming death. She just felt apart from this thought. She was in anxiety, panic attack. She vomited all the time, on the verge of psychiatric hospitalization. It was such a severe case. So what is the connection of all her symptoms? lack of libido, fear of death, anxiety, vomiting. And how do I know that the reason for all of that is trauma? And you know what? Before that, we need to speak what is trauma and how we'll define it, and what are the things in life that causes trauma. So, how will we define trauma? Or what glasses do we wear? Because we can wear many glasses, even if in Chinese medicine. We can look at that in, I don't know, Shanghai glasses. We can look at that 5-element glasses, TCM glasses, many glasses. It's the same as in trauma. And by the way, as many glasses that we are able to wear, we will be more advanced practitioner. That's at least what I consider or what I think. So in trauma, we can put many glasses, and each definition will focus on a different aspect of the trauma. And some will be wider and some will be narrow. So let's see a few glasses, a few definitions. So we can start with the psychiatric definition, which is PTSD, post-traumatic stress disorder. And you know what is the difference between someone that has a trauma and someone that has a PTSD? The main difference is that the one with PTSD went to the psychiatric and had a diagnostic. And basically, PTSD will be defined by 4 factors. The first one in the intrusive. The trauma is intrusive, is coming back to the present. Avoidance. The person with PTSD will try to avoid anything that arousing the trauma. It will be defined by a negative thought about the world, negative thought about a traumatic event, and towards myself, towards the person that was traumatized, that had trauma. And the last one will be hyperarousal of the sympathetic nervous system. And bear in mind that even the PTSD definition using the body language as well, the hyperarousal. So this is one type of definition. And if we'll take Jane case, I don't think she's fallen into PTSD. If I consider it a trauma, she doesn't have intrusive memories or anything from the trauma. She's not trying to, maybe avoiding sex, but that's it hardly can be defined as PTSD. So let's go to another definition. The reaction, the body reaction or the person reaction, the self reaction towards the event, either when it happened, so what happened to my body, what happened to myself when I was in this event, and more important is what happened to me when I remember the event. So we don't, us as practitioner, we are working with the body. As Chinese medicine practitioner, we are working with the body, which means we are working through the present moment. We can reach the past, but we are working through the present moment. So the reaction that happened when the person is remembering the event, talking about that, or feeling it again, it's very, very important. And we'll talk about that at the seminar. And if we'll take Jane case, it's definitely a reaction. When we touch the lower abdomen, the reaction is telling us the body remembers that it was a trauma back 10 years ago. The repression, another way, when the body and the self and the mind and the psyche is putting so much energy in repressing something, either not talking about that, either not expressing any emotions when talking about that, either even not remembering it, that means that this is a trauma. We can feel it in the treatment room when speaking with a patient, and we can feel it in the pulses as well. Basically, mainly in the heart position, but to feel that something is repressed, and not just with the heart, we can do with the divergent meridian as well. But that is something very important that we can sense and feel. And the last one is a stagnation. As I said earlier, every trauma has stagnation. Something is stuck there. If we will go back to the psychiatric definition, if you remember, the first symptom was intrusive, which means the back is hunting me. The stagnation in the past is still stagnant in the present. I hope I made my point there. So we can feel the stagnation in the symptoms, in the personal life, and in the pulses as well. So each one can show us a different angle, a different perspective, different definition of what is trauma. And what causes trauma? So many things. Can you think about a few? Or I will give you the list, because we can hardly speak, I guess, in this video lecture. Sexual assault, of course. Now, how common do you think sexual assault? 1 out of 3 to 5 women. Doesn't matter where doesn't matter in the West, East, Europe, America, Israel. That's generally the numbers. Now, rape is 1 out of 7 women. Now, there's a difference between sexual assault and rape, but it's not the time. It's important to remember that with kids, it doesn't matter if it's a girl or a boy. 1 out of 6, girl or boy, was molested in childhood. Of course, mainly from a male, but it doesn't have to be necessarily. There is also female that are doing the sexual abuse. Physical assault can be a trauma as well. Accident. I don't know how many accidents there are in Austria, but in Europe there are quite a few a day. Serious injuries a day, few hundred serious a day. War or terror attack. Prison, being in prison can be a cause for trauma. Operation, as we talked about Jane, and natural disaster as well. Something that is important to remember or interesting to know, they estimate people that will suffer from PTSD after earthquake. Do you know how many will suffer from PTSD? 3%, which means from 100 people that were in an earthquake, 3% will have post-traumatic stress disorder after that. In war, 25% will have PTSD, which means that 100 people went to a battle, 25 of them will have some type of PTSD. Rape, women will have 50% of them will have PTSD, and male will 90% will have post-traumatic stress disorder. And we will discuss the numbers and why later in the seminar this afternoon. Now let's go back to Jane again. Do you remember the symptoms? Lack of libido, fear of death, anxiety, and vomiting. And I still need to make my point. The source for all the symptoms is her trauma from her surgeries. Now, when we started to work with Jane on the level of the trauma, both indirectly and directly on her lower abdomen, now she had a long vertical scar from all her cesarean sections with like a deep, wide scar, very hard scar. So we started to work on that, and you know what happened? She started shaking all over her body. She shook during the treatment itself, and after that at home as well, a few times, like a long 10-20 minutes of vibration and shaking. And I would like to suggest here that every true healing, and I'm not talking only on treating trauma, every true healing in general, I consider that is involved in releasing repressed energy. Now, this repressed energy or trauma, when it's released with shaking, heat, cold, or pain. It can be all of it or just some of it. I'll give you an example. What do you do when something hits you on the hand, on the arm? Do you pay attention to the pain, or you are trying to avoid it, to rub something there, to take the painkiller, or just try not to think about that? Generally in life, we are trying to suppress the pain and to avoid it, especially in trauma, but not just in trauma. We are doing everything to avoid it. So in this plane of pain or trauma, there is all kind of repression mechanism. It can be a mental repression, emotional, even physical repression. And in my seminars, I am talking about the Chinese medicine mechanism of repression and suppression, meridian-wise and energy-wise. And I think it's one of the fascinating things in Chinese medicine. Now, so we have this area that we are trying to avoid, trying to repress the pain. There is a blockage there in a form of stagnation or cold or maybe heat. And once we touch this area, once we pay attention to the trauma, to what happens there, the healing process is starting. Now, all the things that are suppressed here, the pain, the heat, and whatever, is floating to the surface because we release stuff from the internal to the exterior in order to take it out. And then we feel the shaking, we feel the heat that coming out, the cold or the pain. And of course, it's much more complicated because sometimes the cold is repressing the heat or the heat the cold, and what's going on with the vibration and stuff, that's more complex issues, and not from now, it's more for advanced stuff. Now, bear in mind that in surgery, any type of surgery, we face our deep fear of death. We face helplessness, lack of control, and both of that are all in the core of the traumatic experience. And in Jane's case, it was reflected in her fear facing her parents' death. Another thing, once there is a trauma, physical trauma or emotional one, the flow of qi and blood is blocked. And if we will take Jane's case, the blockage with her is in her lower abdomen, resulting in a blockage in her libido. By the way, there is a special feature about trauma in surgery. You know what is unique to operation rooms? It's cold there, very, very cold. And the cold enters the body through the muscles, the open tissues, and it's getting trapped there. And in this case of Jane, cold and libido doesn't go well together. And what about the vomiting? What do you say? Is there any connection? I would like to suggest that fear and trauma have a great impact on the diaphragm. I think it's the diaphragm. It's one of the most overlooked organs in Chinese medicine. And the impact of trauma is causing the contraction of the diaphragm and vomiting. I consider it so important that I think every treatment, every case should be address the diaphragm in one point or another. But again, that's more advanced issue. Jane's case is just one example of trauma. And I presented here just a tiny example from 3 years of treatments. Now I want to address something for us as practitioners. There are many things in our life that has a potential to cause trauma. And the impact of trauma is vital in so many levels, physically, emotionally, spiritually. So many times, all our effort as practitioners will not bear fruit until we will address the trauma. I would like to give you an example from the clinic, what I'm talking about. And I will give this example in more details in the seminar itself. A young female patient, 25 years old, with main complaint of PMS. The PMS starting from the ovulation, but really hard PMS. Fatigue, depression. She's very, very sensitive. She starts to harm herself and she has rage during these 2 weeks. How will you diagnose it? May I suggest liver stagnation? Does it go well with the symptoms? Now, prior to her arriving to me, she was treated with Chinese medicine for about 6 months. I am sure with a great practitioner, but with no change in the symptoms whatsoever. Only when she arrived to me and I treated her as trauma, as sexual trauma, abuse, the change was amazing with only 2 treatments. I'm not saying that I healed all her trauma in 2 treatments. Nevertheless, her symptoms were reduced with a treatment that addressed the trauma itself. And we will talk about that later in the seminar. Back to us as a therapist. I would like to suggest that being alert to the existence of trauma is so important during the treatment that we must understand that so many times the trauma is deeply repressed and we have to gently assist it to be revealed. And I would like to suggest that as a therapist, we need to know how to heal trauma. But much more important, we need to know how not to make it worse. For example, a male therapist that treats a female patient that suffers sexual abuse can be so harmful to her and to the therapist as well. And we'll talk about that later on in the seminar. Remember that when things are repressed, we are not aware of it, which means that this patient, as I was talking about a female patient and a male therapist, on a treatment bed, could not even be aware that what she is feeling now in the treatment is because of the trauma. So it's so complex issue. So we work and we heal through the body. So many times the body is the one that expresses the trauma through symptoms and illnesses. And it's the same body that is the gate for the healing process of trauma. So from one hand, we need to be careful, and from the other hand, we are the one that can heal the trauma. If you find all of that interesting, you are more than welcome to my seminar this afternoon. I will extend much more than I was talking here. And we will talk about the basic of healing trauma, what to do, what to avoid. We will understand it from the Chinese medicine point of view as well. So enjoy the rest of the seminar, and I will see you this afternoon.